Good evening, everyone. My name is Mary Jo Meissner. I'm Vice President for Communications and Public Affairs at the Boston Foundation, and I'm pleased to be here this evening along with my colleague Allison Bauer, who will come up after me. We are here to talk about what the Boston Foundation is doing about these issues that you've spent, I guess, this semester talking about. And we're going to look at it both from a public policy perspective and also a programmatic and grant-making perspective. For those of you who don't know about the Boston Foundation, we are Greater Boston's community foundation. We're nearly 100 years old, and we have been doing incredible grant-making work here in the foundation or here in the city for all of that time. But I think a lot of people don't realize that the foundation is more than grant making. We are a bit of a think tank, and we do an awful lot of public policy work, and over the years have realized that nobody could possibly have enough money, despite the fact that we have $800 million, to make grants to change the important challenges and issues that we're all working on without systems change. And so a lot of the work that we do is grant making in conjunction with public policy change and reform. So let me see if I can, how do I move this, Jan? Sorry. There you go. Great. You've probably spent a lot of time this semester talking about the crisis in the issue of food and the food industry. But just to review from our perspective, what is the crisis? From 1980 to 2010, the rising cost of medical services has risen dramatically, consuming larger percentages of household, business, municipal, and state budgets. Americans spend more than twice the average of other wealthy, developed nations on health care, yet our outcomes are much, much lower than our peer nations. This is a slide that we love at the Boston Foundation. You'll probably see it in a bit again, because Allison will probably use it as well. Massachusetts leads the nation when it comes to access to health care, particularly in light of the major health care reform effort of a few years ago. And while access to care is critical to screen and respond to illness or injury, no amount of care can substitute, as we all know, for healthy behaviors, making healthy choices in a clean, safe, and supportive environment. As this slide shows, lifestyle and environmental factors account for almost 70% of the average person's health, yet nationally we only spend 4% of national health expenditures on healthy behaviors. And here's another one of our favorite slides. We call it the crowd-out slide. With academic teaching hospitals and specialties and subspecialties and clusters of science and innovation here in Greater Boston and Massachusetts, we are a world-class center of medical services. We spend $10,000 per capita and $65 billion annually in public and private health care combined. As the spending continues to increase, however, the spending imbalance crowds out investment in the very social determinants of health that would positively impact health outcomes, which serves to further negatively impact all of those things. Historically, Massachusetts has been a model for excellent public health programs, but with the rise in health spending, public health investment has fallen 25% over 10 years. So as the spending mismatch has widened, obesity rates, as you probably well know, and your conversations here have doubled. Today, 1 in 3 children in and 3 in 5 adults in the Commonwealth is overweight or obese, a fact that greatly increases the prevalence of preventable chronic diseases such as type 2 diabetes. Given these unsustainable trends, it is clear that we need to focus on policies and practices that can achieve both better health and greater fiscal health going forward. So how do we turn this around? Many researchers have told us what I think we all know intuitively. To turn around a problem this broad and pervasive, we need to have strong action across many diverse fields for many years. For that reason, the Boston Foundation, and we are a permanent institution. As I said, we've been here for 100 years, and we plan on being around for another 100 years. So when we get a problem kind of in our grip, we're going to stick with it. And that's what's required with something of this scale. The Boston Foundation, along with our partner, the New England Healthcare Institute, known as NEHI, have created something called the Healthy People, Healthy Economy Initiative. And as part of it, we've convened a coalition of leaders to help bring about the kind of change that we need. And as a way to consistently stay on top of the wide range of issues that we feel need to be dealt with here in order to move the needle in a truly effective way, we have created an annual report card on how Massachusetts is doing in the effort to become the national leader in health and wellness. We really believe at the Boston Foundation that data drives change, and access to data drives change even better, so that one of the key tactics that we continually use is important research reports and report cards, and we do that often in conjunction with Northeastern University, and Barry Bluestone's here. We partner with Barry a lot on economic reports and various kinds of report cards. We have copies of this report card with us here today, so it's on the table on the outside, and we encourage you to take one with you when you leave. So what is this report card? It identifies a number of policies, programs, and practices that we feel are essential to creating better health and reducing the impact of preventable chronic disease. There are 14 of these items. We came up with them over a course of a year in working with our leadership group, and they're categorized into 4 major groups: physical activity, access to healthy foods, investments in health and wellness, and citizen education and engagement. In the future, there may be more policies and practices that we would track in the report card, but for now, we think 14 are plenty to keep on track of. And we feel these are the ones that are at the center of a statewide movement to improve health. So why do we need this? Because the causes of poor health, including unhealthy weight, are so pervasive, and the solutions are so numerous and all-encompassing that we must make sure that strong and concerted action is taken in a comprehensive approach. We feel that if you just move the needle on 1 or 2 or even 5 of these, we're not going to get the overall kind of effect and the ability to move the change that we feel is necessary. And we do feel that we all have to have a sense of responsibility for action in many, many areas, and this is a tool for promoting that sense of responsibility. Our goal was to track action and impact. That is to track whether we are taking action and making progress on implementation of critical policies and programs, and ultimately whether these actions are having an impact on improving health. So for the first year of the report card, we gave grades to each one of these areas. This next year, which very soon in June, we will issue the second of these report cards. This was the first one. And we are going to start using data to talk about, have we moved the needle in some kind of way in addition to the grade. The good news we find here is that state government and numerous nonprofit and private groups are taking action in numerous fields, and in many cases they're doing very innovative and cutting edge things. The challenge they face and we face is a challenge to persist in adopting and implementing these despite tough economic times. Thus, our grading system reserves an A for action that is paying off in demonstrable improvements in health and a reduced impact of preventable chronic disease on the economy. Unfortunately, we did not give any A's in this first report card. Meanwhile, our other grades reflect varying levels of progress that we are making in moving policy and programs. They range from a high of B for areas where we've made a good start in instituting and implementing promising practices to a low of F for areas in which critical policies are receiving little or no consideration, or where there's little chance of making any headway soon. The first area of focus is physical activity, and this is a key area of the primary prevention effort needed for a healthy lifestyle, as you've heard. There's 3 areas here that we talk about. One is youth physical activity. Massachusetts gets a D here. The recent Trust for America's Health report, which was called F as in fat, reported that Massachusetts had the worst score in the country for the percentage of high school students engaged in regular physical activity. Just think about that. Massachusetts got an F in that area, and we have the worst. You don't think of ourselves that way. Also, only 18% of Massachusetts schools offer daily gym classes compared to a 30% national average. Our state laws require schools to provide physical education, but the number of hours of instruction is not specified. And as a result, many schools offer none. That changed in 1996. I think many of you would probably have assumed that we still require kids to take PE in our schools, but we do not. The coalition that we work with, or that we created, is working with Representative Jess Sanchez, who's the co-chair of the Public Health Committee in the House side of the legislature, to file legislation that would change this by requiring that schools offer at least 30 minutes of physical activity daily for students. Biking and walking, here Massachusetts has done well and it's earned a B, as the state ranks in the top 10 of the percentage of communities and commuters walking or bicycling to work. We've shown a real commitment in Massachusetts to a complete streets program, and in 2011 or 9 we passed the bicyclist safety bill. In healthy transportation planning and design, this is another area in which Massachusetts scores well with a B. We have local transportation systems that strongly influence public health by encouraging physical activity. We rank 4th best in the nation for the percentage of workers using mass transit, and that coupled with our commitment to mass transit-oriented development, which we have worked on with Northeastern University, as well as being one of the few states to authorize the creation of a statewide healthy transportation plan, have made us a national leader. But as we well know, given the recent headlines, funding for many of these projects is still lacking, and particularly we're very concerned about the MBTA budget deficit right now. The next area of grading is access to healthy foods, and we've got 5 areas that we look at here. One is farmers markets. Massachusetts gets a B in this area, as the USDA has ranked the state 6th best in the nation for the number of markets, 228, including winter markets. And there are also more than 50 markets participating in the SNAP program and accepting EBT cards. There's a real potential for us giving an A here, because these things further expand in low-income areas and through expansion of the SNAP program. We can see that happening easily. Food deserts. A 2011 report found that Massachusetts is the 4th worst state in the nation for food deserts. Here again, who would have thought that, really? This is areas where healthy, affordable food is difficult to obtain. It is prevalent in rural as well as urban areas, and the most prevalent in low socioeconomic minority communities, and it's definitely associated with a variety of diet-related health problems. This same report found that Massachusetts had fewer supermarkets per capita than most states, and that's why we have given it a B, a D. The good news is that the Food Trust, which is a national entity that started in Philadelphia, is working with leaders in our state, including the Boston Foundation and the Mass Public Health Association and the Food Association here, to come up with recommendations that will be filed soon to turn that around. Sugar-sweetened beverages I'm going to come back to in a minute. That is certainly a big kahuna, and it got an F in our report card, as it should. Healthy school meals. Making change to school lunches is a big challenge given federal guidelines and facility limitations and funding constraints. But we've had real leadership from our state public health department in advocacy from the community here, and that's resulted in some of the strictest standards in the country. However, the rules apply to food sold in vending machines, and so it's a good start, but it earns a C. Trans fat policy is the 5th area, and while fast food chains are now dropping the use of trans fat, the issue remains a serious one for health that should not be overlooked. There are a number of communities that have made progress here, Boston, Brookline, Cambridge, but we still have no statewide legislation, so we gave it a D. Sugar-sweetened beverages, this is really the one that gets a lot of attention and should. The consumption of calories from sugar-sweetened beverages, as you well know, has risen markedly over the last 30 to 40 years. I'm not going to go through all the negatives about them, but we do know they are a major contributor to obesity, and particularly to the rapid increase in childhood obesity in the state of Massachusetts and elsewhere. So currently, Massachusetts is only one of 17 states that does not apply any tax on any type of soft drinks. So sugar-sweetened beverages in Massachusetts are defined as food, as is candy in the Massachusetts general laws, and therefore they are exempt, as food is, from taxing, from the state sales tax. And so essentially we're subsidizing their purchase. However, a poll that we undertook last year shows about 2/3 of Massachusetts voters would support removing the current state subsidy for sugar-sweetened beverages and candy if part of the resulting revenue were used to support programs that fight childhood obesity. And even without that, half of registered Massachusetts voters would support removing the subsidy anyway. So legislation that we've helped write has been filed by Representative Kay Kahn, and that would eliminate the current sales tax exemption. Governor Patrick, we were cheered by the fact that he included that in his budget when he filed it in January. However, the House today failed to include it in their budget. It's our intent, however, to keep working on this until we are successful in removing that subsidy. There's lots of other areas here, and I'm going to try and quickly go through them. This area of health and wellness investments, you can see what the grades are here. I'm just going to light on the public health spending one, because that's really important for us to kind of disaggregate. It's not a grade about our public health programs in Massachusetts, far from it. We have a tradition here of aggressive and innovative public health programming, and that has resulted in recent years in tackling many major things: menu labeling, BMI reporting, and the launch of the Mass in Motion initiative in the state. But unfortunately, funding of public health has been radically cut here over the last several years, particularly in recent years with the downturn. And unless we get some of the investments back, we're going to continue to give this an F, and we're going to work hard to change that. Primary care has the same kind of issue. This is an awesome place for receiving primary care. The problem is that it's not as we've not made a commitment to put it at the center of health care and payment reform, and we'd like to see that happen. Citizen education and engagement. There's really not much going on in terms of health literacy. There's no systemic effort underway here, and that's why we gave it an incomplete. And we gave a good grade in BMI reporting, and health impact assessments are something that are just getting started in our state. So, next steps. Massachusetts leads the nation in access to health care, as I said, in innovation and educational attainment. But the recent and dramatic increases in health and youth obesity are resulting in this rising tide of preventable chronic disease, and it's something we have to get on top of, not only for our own health, but it's a threat to our economy. And so a focused agenda is the one that we're putting forward, is what we're behind, and we invite you to join us in that effort. And with that, I'm going to turn this over to my colleague, Allison Bauer, who's Program Director at the Foundation in charge of our health care and health and wellness area. And she's going to talk briefly about our community-based approach. Thank you.